Honorable Claudia Groom-Duke, Secretary of Health and Social Services, Administrator, Division of Health and Social Services, Ms. Ethelyn John, Chairman of the Board, Tobago Regional Health Authority, Mrs. Brown, other members of the board, administrators of the different divisions in the Tobago House of Assembly. I think I saw coming in a while ago our Chief Administrator, oh yes, Chief Administrator, Mr. Boris. Our colleagues in the Division of Health and Social Services, all the pillars that hold these great organizations together. We are gathered here this evening, as we do once a year, to get together in camaraderie. You know, in any organization, particularly one as big as ours, we need lots of support, we need lots of pillars. And each and every one of us here this evening are a pillar that holds that great foundation called the Division of Health together. During the years, I'm sure you would hear from other senior members in the division, we would have had our challenges, but by the grace of God, we rose above those challenges. Where there were valleys, somewhere along the line, we rose above the valleys and we went to the mountaintop. And we are here this evening to just relax and enjoy ourselves, as I'm sure the Secretary would let us know exactly what the future holds for us as we look back at the past and look forward to 2012. There are lots of things in store, so let us get ready. Let us enjoy ourselves this evening, but let us get ready knowing that the way ahead is long. It may be hard, but with the support of each and every one of us, we are sure that make it we will. And the Division of Health and Social Services will continue to be stronger than we were in 2010 and 2011. So we all look forward to 2012. Lots of things are happening. I would not take up your time to tell you what they are, because I'm sure when the Secretary of Health is on the podium, along with your administrator, you shall be so informed. It is indeed a pleasure for us to be here this evening. And you know, in this big organization, there is, besides the Secretary of Health, there is a very dynamite woman who leads this division, all the administrative structure, all the hard decisions that has to be made, and all the implementation that has to be implemented as directed by the political directorate in order to make sure that the Division of Health and Social Services is the one that we all want it to be. So at this stage, I would like to invite on stage Ms. Ethelyn John, Administrator, Division of Health and Social Services, to welcome each and every one of us here this evening. Ms. Ethelyn John.
Madam Chairperson, Assemblyman Claudia Groom-Duke, Secretary of Health and Social Services, Councillor Gary Melville, Secretary, Agriculture, Marine Affairs, Marketing and the Environment, Dr. Ellis Boris, Chief Administrator, Tobago House of Assembly, Ms. Heather Carruth, Administrator, Division of Agriculture, Marine Affairs, Marketing and the Environment, Mrs. Jennifer Fabian Brown, Chairman, Board of Directors, Tobago Regional Health Authority, board members of the Tobago Regional Health Authority, Mr. Paul Taylor, Acting Chief Executive Officer, Tobago Regional Health Authority, Head of Departments of the Division of Health and Social Services, General Managers of the Tobago Regional Health Authority, staff of the Division of Health and Social Services, staff of the Tobago Regional Health Authority, special invited guests, ladies and gentlemen, members of the media, good evening. On behalf of the Secretary of Health and Social Services, it gives me great pleasure to welcome you to this annual Christmas dinner. The Division of Health and Social Services during the year 2011 would have undergone a series of changes. Indeed, I am one manifestation of that change. And excuse me, let me acknowledge Assemblyman Tracy Davidson Celestin and Mr. Celestin, who is with us. The division would have undergone a number of changes, inclusive of the previous secretary in the Division of Health and Social Services, Mr. Albert Pilgrim, and the assistant secretary, Mr. Huey Cadet, as well as our previous administrator in the Division of Health and Social Services, Mr. Heather Carruth. Indeed, the year would have started with these persons at the head of the ship, and they would have steered the division to where we are in a position to go forward today. And ladies and gentlemen, let us acknowledge their efforts at the division. Let me extend my heartfelt thanks to the department heads of the Division of Health and Social Services for their assistance, cooperation, teamwork, and commitment in meeting the new secretary of the division, as well as myself, when we came on board in August of 2011. Indeed, special mention should be made of the Public Health Inspector 4, Ms. Lois Solomon, the Director of Social Services, Mrs. Sherma Frank Joseph, Head of CPEP, Mr. Hubern Seeley, Manager, Litter Eradication, Mrs. Elizabeth Martin, the CMOH, Public Health, Dr. Carlene Radix, and indeed, all the heads of department at the Division of Health and Social Services. Not to be left out is the Tobago Regional Health Authority, which when we came on board in August did not have a board. And indeed, they also were going through changes as well because they lost a CEO as well, and they had a new acting CEO, Mr. Paul Taylor. And indeed, there was a spirit of cooperation and rallying to get the work done. And I think at the Division of Health and Social Services, we should all give ourselves a round of applause for having made that special effort. As the head of not only the Division of Health and Social Services from an administrative point of view, I would like to make special mention of my executive administrative assistant, Mrs. Michelle Daly Melville, as well as my clerk Steno 4, who I'm looking around to see if she's here, for this special assistant and hard work. Indeed, anybody who passed through the administrator's office know that they are doing 4 and 5 things at the same time. But from general administration, where we are at, we are seeking to push the Division of Health and Social Services in terms of computerization of the registry, creation of a vault, establishment of an IT unit, strengthening of the accounts department, and we are also looking at training across the board for all members of the Division of Health and Social Services. Indeed, the Secretary, in her address to you tonight, will speak about the new vision and strategy that the division would be endearing in order to see a healthier Tobago in 2012. Let me extend special thanks to the Events Committee, especially Mrs. Grace Dennis, for their dedication, team spirit, and going the extra mile. Indeed, ladies and gentlemen, what we see in front of us tonight is an example of their teamwork and commitment. Let us give them a round of applause. And for those of you who attended Assembly Day, indeed, the division participated in the Sports and Family Day. And where did we come for March Past? Third. And what was the slogan? DH? DHSS, right? And we also placed first for mascot. So give them a round of applause, ladies and gentlemen. Ladies and gentlemen, as we go forward into 2012, I look forward to us being more competitive, more visionary, more strategic in our outlook and in our focus in terms of providing health care for the population of Tobago, as well as all of our visiting population. I would like to thank each and everyone present for their support in 2011, and indeed, let's hear it for all the staff members who are here from General Administration, Public Health, Tobago Regional Health Authority, Social Services. Let me hear all the representatives from CPEP. And let us hear it for litter eradication. Ladies and gentlemen, on behalf of myself and my family, I take this opportunity to wish each and every one of you a merry and God-filled Christmas and a bright and prosperous New Year. Ladies and gentlemen, I welcome you.
Ladies and gentlemen, as I mentioned earlier, the Division of Health and Social Services is a very compact, dynamic division. It sometimes seems as though it's an octopus with so many legs and feet spread all over the place in order to bring the whole division together. It is indeed a pleasure for me this evening to call some of the head of these divisions to bring you greetings. First of all, I would sincerely like to apologize to Assemblyman Tracy Davidson and Mr. Davidson. Sorry, Celestine Davidson. What it is? Davidson? Celestine. Mr. and Mrs. Celestine. First up, I'd like to, on my own behalf, welcome and apologize for not recognizing you in my initial remark. I'm looking around to see if there is anyone else who I had forgotten. I had mentioned all administrators. The cameraman is looking at me and saying, I didn't welcome him. Welcome, sir. Yes, as we proceed on this evening's program, I'd like to now call on Mrs. Elizabeth Foster Martin of the Litter Eradication Division to bring greetings to us.
The Honorable Secretary of Health and Social Services, Mrs. Claudia Groom-Duke, the Administrator of Division of Health and Social Services, Ms. Ethelyn John, Chief Administrator, Mr. Ellis Burris, Dr. Ellis Burris, Chief Executive Officer of the Tobago Regional Health Authority, Mrs. Jennifer Fabian Brown, Mr. Paul Taylor, heads of department, other secretaries, and other administrators of division. It is my pleasure to address you this evening as we recognize the achievements we have made this calendar year through the grace of God and collaborative efforts. The litter eradication program had 3 major accomplishments this year, namely the relocation of the office, the continued success operation of the program, and the initiation of discussions to expand the scope of the program. The first accomplishment relates to the relocation of the Litter Eradication Program Office. As of September 2011, the Litter Eradication Program moved its office from the Public Health Office at Signal Hill to the Salandi building at Coiler and Piggott Streets in Scarborough. This is welcomed news as the LEP had to share office space for several years and at one time was without an assigned office location. On behalf of the LEP staff, I would like to take this opportunity to publicly thank the Public Health Department for accommodating us and for our efforts made by the past and present administrator to secure an office location. The second accomplishment is the continued successful operations of the program. As of today, we employed many persons who serve as office staff, supervisors, shift and staff, and drivers to ensure that the litter is collected from major roadways from Scarborough to Crown Point 7 days a week, inclusive of public holidays. In 2011, or calendar year, we were able to collect and dispose of 12,675 garbage bags. LEP's efforts therefore complement the work of public health and the CPEP. The third accomplishment is the initiation of discussions with the administrator regarding the strengthening of the work of the LEP. Some of the ideas are expansion of services to such as Roxborough, Charlottesville, and Blackrock, and securing contracts for workers. It is my hope that these achievements and more may be reported at next year's gathering, if God's will. In closing, I would like to recap that the LEP has successfully relocated its office, successfully continued operations in 2011, and discussions have started regarding strengthening the work to be done in 2012. I wish you and your loved ones an enjoyable and safe Christmas and a bright and prosperous New Year 2012. And may God continue to bless the work of the division in 2012. Thank you.
At this time, I'd like to call on Dr. Carleen Radix, our County Medical Officer of Health, to bring greetings to us this evening.
Madam Chairperson, Assemblyman Claudia Groom-Duke, Secretary of Health and Social Services, other secretaries, Dr. Ellis Burris, Chief Administrator, Ms. Ethelyn John, the Administrator in the Division of Health and Social Services, and other administrators present, Ms. Jennifer Fabian Brown, Chairman of the Board of Directors of the Tobago Regional Health Authority, other board members, Mr. Taylor, Chief Executive Officer, heads of departments of the Division of Health and Social Services, general managers of the Tobago Regional Health Authority, staff of the division and of the Tobago Regional Health Authority, specially invited guests, ladies and gentlemen, and members of the media. Good evening. It is a pleasure for me to bring greetings on behalf of the County Medical Office of Health here in Tobago. Specifically, I'd like to say the County Medical Office of Health is only one piece of the large puzzle that is tackling health issues here in Tobago within the Division of Health and Social Services. And I'd like at this time to acknowledge the strategic leadership from the Secretary, both present and past for this year, and the administrative leadership with regards to implementation of those strategies, present and past for this year, for the role they play in helping our office to accomplish its goals. In addition, we have a collaborative relationship with the Tobago Regional Health Authority, since a lot of our goals overlap, and so we work hand in hand toward a healthier Tobago. At this time, I'd like to acknowledge specifically under our office, different departments and their accomplishments. As was mentioned before, the Public Health Inspectorate with Ms. Lois Solomon and the work that they have been doing over the year. I'd like to make special mention of the process, the fight against dengue this year, together with CPEP and the Public Health Department. A lot of work was done, and we saw the results of that. Within my office, the Health Education Office, I acknowledge our Health Education Officer, Ms. Anika Benoit, and Ms. Lisa Shaw. They have been out in the communities alongside persons from TRHA, helping to spread the message that we all need towards healthier lives. So eating better, getting exercise. I know we've been out in the communities trying to get people to exercise, eat better, etc. Our epidemiology and surveillance unit gained an epidemiology officer this year in Ms. Bridget Smith, and she is leading the charge in making sure we use information to make decisions. So we've been able this year to track a lot of communicable diseases, including, for example, dengue, and to show the numbers dropping with intervention. And we are moving forward to introduce a chronic disease surveillance system so that we can have as much an idea of what's happening with our chronic diseases as we do with our communicable diseases. In our surveillance unit, we have hardworking nurses in Ms. Edwina King and Ms. Janice Dillon Kirk, who beat the pavement heading to hospitals and communities and elsewhere to get the information that we need for the surveillance unit. I'd also like to acknowledge my medical officer, Dr. Chima Izijiafor, who is always willing to go the extra mile to do what needs to be done, as well as the administrative staff in my office, Ms. Perline Baird and Ms. Carissa Samuel, and I couldn't forget Ms. Murphy, who always has a song while she works. So I'd just like to say on behalf of all of us, it gives me pleasure to bring greetings to you, and I wish you all a very Merry Christmas and all the best for 2011. Thank you.
Yes, thank you very much, Dr. Radix. I told you initially there are lots of branches where this division is concerned. Loads and loads of division go into making this division. When it's successful, we all clap. When there are errors and errors, we all hang our heads in shame. But thankfully, by the grace of God, we are getting there where our heads are mostly up than down. At this time, I'd like to invite on stage the Acting Chief Executive Officer of the Tobago Regional Health Authority, Mr. Paul Taylor, to bring his greetings to us.
I'm going to be the first to say all protocols observed. I want to make special. I want to specially, of course, recognize our secretary, Mrs. Claudia Groom-Duke, and all our special guests. This year, or last year, the TRHA had the pleasure of having over 36,000 people come to our A&E department. We had 104,000 visits, I should say, at our health centers. And that just gives you a sense of the extent in the way our services are used on the island. We have had our challenges, but by and large, we have attempted to provide the best service we can with the resources we have available. We have been able to open the new Charlottesville Health Center, most recent, an outreach center in Golden Lane, as well as Patience Hill. We are in the process of refurbishing our laundry. And for most of this year, we've expended a lot of energy in preparing to occupy a new hospital in 2012. And so a lot of effort has gone into preparing our departments, preparing the organization, putting the plans in place to make the commissioning of the new Scarborough General Hospital a really big success. So I want to say on behalf of the management and staff of the Tobago Regional Tobago Regional Health Authority, I want to express to you our heartfelt thanks for the way you have responded as our clients and customers. And we want to wish each person a happy and holy Christmas and an expectant 2012. Thank you very much.
Thank you very much, Mr. Taylor. At this time, it is indeed a privilege and an honor to welcome in our midst the Honorable Chief Secretary, Mr. Orville D. London. We continue with greetings from the different divisions. It's taking longer than we thought it would, but we're going to be finished in another couple of minutes. At this time, we'd like to welcome on stage the newly appointed chairman of the Tobago Regional Health Authority's Board of Directors, Mrs. Jennifer Fabian Brown.
Thank you, Madam Chairperson. The Honorable Mr. Orville London, Chief Secretary of the Tobago House of Assembly, Assemblyman Claudia Groom-Duke, Secretary, Health and Social Services, the Administrator and the Division of Health and Social Services, Ms. Ethlyn John, Chief Administrator, Dr. Boris, and all the other administrators present here this evening, all the secretaries present here this evening, fellow board members, management and staff of the various divisions, units under the Division of Health and Social Services, good evening. At this time, I would like to greet all of you, employees for the various divisions under the umbrella of the Division of Health and Social Services. On behalf of the Board of the Tobago Regional Health Authority, we want to thank you all for your cooperation that you have given to us at the authority over the past year. We recognize the contribution of all of you to what the healthcare and the social services for this island of Tobago. And we appreciate all the efforts and energies of all of you here today. We, at the Tobago Regional Health Authority, we continue to recognize the contributions and the commitment, especially from those at the Regional Health Authority, for the continued provision of primary community care and with the progress achieved at the secondary care level and the dedication of the staff to the new Scarborough General Hospital project. On behalf of the Board of Directors, I want to wish all of you and your families a safe, healthy, happy, and holy Christmas, and we look forward to working with you in the new year. I thank you.
Thank you very much, Madam Chairman. As I mentioned, there are so many sections within the division. We had representation of a few of the sections. A couple of them we didn't have up here this evening. CPEP, of course, Director of Social Services, the Public Health Inspector in charge of the whole Public Health Division. And that, ladies and gentlemen, with all the others, represents that division, that dynamic division called the Division of Health and Social Services. A very special part of the Division of Social Services now is that band we have we call the Golden Apple. Somehow they didn't want to tell the men that they're older, so they call them, maybe they're going in golden age. So at this time, it is indeed a pleasure for us to sit back after all that talk and talk and talk. Just sit back, relax, and listen to some music as provided by the Golden Apple Orchestra of the Division of Social Services. And who didn't get the Christmas spirit when they walk in here with all? We thought that they were only old men. That is not true at all. Have you seen the young lady in front of you, that horn? Blowing a mean piece of music on that saxophone? Put your hands together for that female saxophonist. Yes, ladies and gentlemen, and I think that is the right cue for us to bring on the head honcho, the person who has all the responsibilities on her shoulder for guiding the Division of Health and Social Services into the paths of green pastures. Put your hands together as we welcome the Honorable Secretary of Health and Social Services, Mrs. Claudia Groom-Duke.
Let us give the chairman a round of applause. She has been doing an extremely wonderful job. And now join me as we recognize and acknowledge the Honorable Orville London, Chief Secretary of the Tobago House of Assembly. Let us bring down the house, giving him a round of applause. And also join with me as we recognize and acknowledge all of my colleagues, the secretaries and assistant secretary in the Tobago House of Assembly. Let's give them a round of applause. And most of all, I want to acknowledge my predecessor, Assemblyman Albert Pilgrim and Mrs. Pilgrim. Let us greet Dr. Ellis Burris, our Chief Administrator. Of course, our Administrator, Ms. Ethelyn John. Give her a round of applause. Please remember she organized your salary. Give her a round of applause. Of course, Ms. Heather Caruth, Administrator, who has been with you for most of the year. Let us give her a round of applause. And also Ms. Jennifer Lizama and other administrators in the House. Let us also acknowledge our Chairman of the Board of Directors of the Tobago Regional Health Authority, Mrs. Jennifer Brown. Let us give her. Our Deputy Director, Mr. Kwamina, and all other directors on the board, our Chief Executive Officer, Acting Mr. Paul Taylor, members of staff of the Tobago Regional Health Authority, and members of staff of the Division of Health and Social Services, and your spouses. Give each and every one of you a round of applause. Other distinguished guests, our members of the media, members of the Golden Apple Band, and other performers, let us really give them a good Division of Health welcome. Let me just take this opportunity to thank each and every one of you for coming here this evening. I wish to extend a special welcome to spouses, partners, and other significant others, and other guests from outside of the Division of Health and Social Services. I also wish to thank everyone involved in organizing this event, preparing the food, serving the food, booking the venue, organizing the decorations. Don't we look lovely? Yes. And so we have listened to the synopsis of our departments as our heads came up here and indicated to you some of their achievements for the year. And so let me take this opportunity to congratulate each and every one of you for the good old Tobago tradition of hard work and sacrifice. Give yourselves a round of applause. Last Christmas dinner, I understand that Assemblyman Albert Pilgrim and Assistant Secretary Huey Cadet were leading the process for your dinner, your party in this Division of Health and Social Services. This Christmas, Assemblyman Pilgrim is basking in the love of his constituency, leading the supportive network for developing Tobagonians as we develop Tobago. And as we work assiduously to strive towards a healthier Tobago, with each of us embracing the mantra that wellness is everybody's business, we in the Division of Health and Social Services feel very strongly that in the year 2012, we will be prepared and be ready for that year in the grace of God. Let us claim that in the grace of God, that in the year 2012, we will be ready, because the year 2012 will be the year of our operational commissioning of the new hospital, as plans to move into the new hospital is accelerated. And so among all of us, there should be a growing sense of urgency, as so much had to be done to prepare for this big move. And so all members of staff must play some part in preparing for the move. And so we know the ultimate prize, and we will have a chance to provide the best care in a truly fabulous state-of-the-art hospital in Tobago, second to none in many parts of the world. Let us give Tobago that round of applause. You know, Morag Jackson, a new hospital director, said, most of us know the effort that goes into moving home. So just imagine that effort multiplied 10,000 times, and you might be a little closer to what it is like moving into a new hospital. Did you hear that? 10,000 times moving into your new home. And so we are prepared to work with every department, unit, and service within the system, supporting literally hundreds of decisions and actions. Every one of them is itemized on a commissioning program plan, and that is quite a plan. And so, members of staff, your spouses, we can look back and say the job is done when we work hard in the preparation for this process. And so this is our legacy. Let us own it with a positive attitude. I take this opportunity to wish each and every one of you a glorious festive season and a splendid new year. During the break, we should hold each other in thought and come back rejuvenated. Let our resolutions for next year encompass our pledge to embrace the health and social services principles unconditionally. I urge all of you to look after yourselves and not let harm befall you. Let us remember that our people rely on the services that our division renders at this crucial time. To those who will work throughout the festive period, continue to keep the lights of hope alive and save as many lives as possible. most of all, enjoy the time you will spend with your families. Enjoy your dinner this evening, and happy holidays, and may God bless all of us richly.
Much, Madam Secretary. I told you that you would hear all the plans that we have for you when she gets here, and I'm sure she did not disappoint you. But I know us, our prime focus of coming here this evening was not to hear no set a talk, and we had to endure all of that. It was necessary, of course. I know we are here for the dinner, and that time is here.
I'm Delisa Dalrymple. I'm working on the TRHA. Well, tonight it's very nice, and I like the music. The music is very nice.
Anthony Sylvester, and I work in the finance department. Well, I'm enjoying it. Well, I find it's a nice environment. The music is nice, and the food was very great.
Thank you.
Okay.
Okay, my name is Keisha Roberts Miller, and I work at the Public Health in Signal Hill as a daily pay checker. I'm enjoying it. I'm enjoying it. And it's much more than what I expected. The food was great, the ambiance is great, and I intend to enjoy the rest of the evening. No. I think I'd rather this one. Yes.
Hi, hello, good night. My name is Sheldon Nichols. I'm working with the fire service department, and tonight is great. The food was nice and everybody's enjoying themselves, great music and everything. I'm here enjoying myself with my wife and her friends in the Tobago Regional Health Authority, and it's a great night, and I want to say Merry Christmas to everyone.
Okay, my name is Olivia Nichols, and I work at the male medical ward at the Scarborough Regional Hospital. Well, tonight is good so far. The music is great. The food was well organized. The lines moved fast and smooth, and the seating was good. So everything's good. Just to wish Scarborough Regional Hospital a Merry Christmas. To all the hardworking nurses who are on duty tonight, Merry Christmas to you.